My name is Tongai Chichaya. I'm a senior lecturer in occupational therapy at Bournemouth University in the United Kingdom. But as you can see, I'm a coat of many colors. Just a disclaimer, I tend to gravitate towards a critical occupational therapy perspective. So the work that I'm going to be presenting today is the work that I began when I was working in Namibia as the national coordinator for the community-based rehabilitation program within the Ministry of Health and Social Services. It was under the Primary Healthcare Directorate. For those who don't know, that's where Namibia is. And please, Africa is not one country, more than 50 countries. Okay, so this work, it all started with an awakening to issues of occupational justice, as Liz Townsend likes to put it. Like I said, I was working at the national level, and that photo there is not in Europe. That is the capital city of Namibia, Windhoek. And my office was just a kilometer within that radius. But then it so happened that I got involved in a project where we were doing work with health extension workers. I basically put my hand up when the ministry was introducing that project to equip young people with knowledge on how they can help their communities maintain or improve health. So we had to travel out to very remote places. So when I got to this environment, that girl there was one of the trainees that we were training in basic ways of community-based rehabilitation. But when I got there and came across many people with disabilities who were living in that environment, very different from where our offices were, I really got unsettled. It's a place where your OT knowledge of bath boards and raised toilet seats basically becomes useless and requires you to start thinking outside the box. So my thought was, if the national disability policy is able to cater for the needs of these people, then everybody else should be fine, because I felt they were the ones who were most excluded. So I then decided to venture on a study on disability policy analysis using the Participatory Occupational Justice Framework. So in this study, I interviewed disability policymakers in Namibia as my key informants, and I had in-depth interviews with persons with disabilities from different regions of the country, different backgrounds, and I also did focus group discussions with occupational therapists, trying to figure out their understanding of the issues that were affecting people with disabilities in Namibia. There are 3 papers that were published, and they're in the references with the details. And the findings were surprising, but they were also encouraging in terms of the potential that occupational therapy has. So just to quickly go through what I found out that occupational therapists had actually a better understanding of the lived experiences of people with disabilities compared to the policymakers. You can see the pink one and the brown one. And at the same time, occupational therapists had a better understanding of the line of thinking of policy makers and how services are designed compared to the way people with disabilities understood how policy makers function. So key things, there were occupational performance barriers that were very evident, barriers that included attitudinal barriers, barriers in terms of accessing to services, accessing to infrastructure, access to information. And there were also, a number of forms of occupational injustice that I identified or that were unearthed, like occupational marginalization, deprivation, alienation. And I also defined a new term, a new form of occupational injustice, which I defined as occupational inconsideration, and it's in my references. Looking at the Participatory Occupational Justice Framework, if you look at it, all the components that it has, I found them to be very relevant in the work that we can do as occupational therapists to influence policy, engaging with the partners. And in this case, the partners to collaborate with were actually those 3 parties. So I then, after the data analysis, I then moved to use the policy analysis approach that was proposed by Bardach in 2012. And I actually encourage people to use this wherever you are faced with two or more options. It's actually a process that helps you to take away the emotions out of your decision making. So I use that, and then I then managed to identify from the data analysis 3 policy options that were support policy, access policy, support policy, and universal coverage policy. And then I used the occupational justice framework to develop evaluative criteria for evaluating the probable outcomes if each of these policy alternatives were to be used. And those were the findings. So basically, access policy emerged to be the one that had the least number of trade-offs, and it scored higher compared to the other policy options. And it is the policy alternative that was most likely to bring outcomes that are just, that are inclusive, that are affordable, and that are politically acceptable. Political acceptability I found it to be very important, because without it, there is no way you can be able to implement anything. So what then did I do? After that, I then wrote a policy brief. It's not meant for you to read, but just to show you how it looked like, which I then submitted to the Deputy Minister responsible for disability affairs in Namibia. And I was actually very glad, because they acknowledged that they had received it, and they actually acknowledged that they are going to include some of the 7 recommendations that I gave into the review process of the new disability policy that they were working on. So that's something that I was very pleased with. In conclusion, we already know enough in order to start acting. And then secondly, the Participatory Occupational Justice Framework gives us a framework that we can use as occupational therapists, our understanding, to actually make a difference in disability policy formulation. And of course, policy formulation is very complex. It's not only OTs, there are a whole lot of other stakeholders. So it is a step-by-step process, incremental changes until we achieve what we desire. So these are the list of references, and those are my contact details. That is my YouTube channel if you want to get more information on the other things that I do. Thank you very much.